الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين.
Jazakallah khair Ubaid. Now I request everyone to please raise for the national anthem. National anthem please.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Now we will have the Rizvi anthem. Rizvi anthem please.
प्यासा जाएगा। अब तक न गया प्यासा कोई, कोई भी न प्यासा जाएगा। ये दरिया बहता जाता है, ये दरिया बहता जाएगा, ये दरिया बहता जाता है, ये दरिया बहता जाएगा।
Thank you everyone. Now please be seated for the program. Now I request Dr. Alkama sir to please escort the guest on the stage. All of you please come. Please ma'am. So let me introduce today's guest, Dr. Professor Afshan Lehji. She is the president of the Indian Dental Association, Mumbai, chairperson of the Women Dental Council, Maharashtra State. Now, ma'am is going to just share her views on the topic, Beat the Threat, Claim Your Life. Without taking much of her time, I request ma'am to be on stage, please.
Thank you very much, madam. A very good morning, one and all. Beautiful Qawmi Tarana by Rizvi College. That's really lovely. Today I'm going to speak on a subject which is very close to my heart, and that is beat the threat. Beat the threat, claim your life. Now you know there is a lot of threat in today's world when you have already seen the different types of cancer. Oral cancer, breast cancer, cervical cancer, lung cancer. So there is a lot of threat, but what is more important is how we claim our life by taking different preventive stage, right? So here, can you please start the... So what is more important in all different types of cancer is the main factor, which is tobacco. So today I am talking to you about oral cancer, which is related with tobacco, and different types of cancers which might be a result of spread from the oral cancer to different parts of the body. So let us start with the tobacco cessation, that is tobacco control. So tobacco is the main factor in which we see nicotine. Nicotine is highly addictive, and it's a major factor for different cardiovascular diseases and lung diseases, that is the pulmonary diseases. You will see that there are more than 20 different types of cancers which may affect our health. And most related death will occur mostly in the low socioeconomic status. So our aim should be to spread the message. Being the educated students, our message should be to pass the message to the generation which are affected by or they are using the tobacco. Next slide. So there are many chemicals which are present in tobacco, and you will see that more than 25 chemicals are present, out of which more than 70 chemicals are harmful and they are carcinogenic. Carcinogenic means ones which can produce cancer. I hope all of you are following that. Carcinogenesis, which produce cancer. So there are more than 70 chemicals which are present in tobacco, and that is harmful, causing the cancer. Next slide. So you will see a number of oral cancer cases have increased tremendously in past few years, and that is mainly because of the tobacco consumption. You will see people take the tobacco in the form of cigarette smoking, bidi smoking, cigar smoking, pipes, pan eating, gutka chewing, and hookah intake. I see a number student outside the college, and it really hurts me. I see them with the pen hookah or e-cigarettes. Actually, e-cigarette is banned now, but still people are using this hookahs, pen hookahs. So my sincere request to all the students that please stop that. You will know the damage it causes to your general health. Next slide. Now let us see the facts about tobacco. We know that our Indian population is more than 135 crores, and out of which you will see 30 crores people suffer with some or the other form of cancer, and 22.5 lakh people die every year because of cancer. That's a big number of people dying, out of which the total number of different types of cancers, you will see 40% of cancer occur in the mouth, that is the oral cancer. And every 6 minutes, believe me, and every 6 minutes, one person dies of cancer in globally. So that's a large number, and it's a threat to our society. I'll tell you some other facts about tobacco, that if you see the plantation of tobacco, there is no fencing, as we do the fencing for other plantation to prevent them from animals. The reason being, no animals come close to the tobacco plantation. Secondly, no pesticide is used for the tobacco plantation. That is because insects also do not come close to tobacco plantation. And we, having such a big brain, we are still using the tobacco. So my sincere request to all the students is to pass the message to the next generation and the previous generation to stop the usage of tobacco. Can you imagine every 6 minutes one person dying of cancer? Next slide. So tobacco consumption leads to chronic debilitating conditions which virtually affects the entire body parts, because because of the eating of gutka or smoking, if the oral cavity, that is your mouth, is affected, and if it leads to cancer, this can go anywhere in the body parts, right? So it may affect the heart disease, it may lead to heart diseases, it may leads to lung diseases. There are about 42 lakh people who may suffer with heart diseases, and 37 lakh people who suffer with lung diseases. Now the cancer number I have already told you, more than 30 crore people suffer with some or the other form of cancer, and every year more than 10 lakh people die because of this. Next slide. Now if we consider the smoker's death, you know that on the cigarette packet it is written that it is injurious to health, and it leads to mouth cancer, throat cancer and lung cancer, and as a result of which you will see the smokers are 10 times more likely to die from throat cancer. They are 12 times more likely to die from lung cancer, and a big figure, 50 times, the smokers are 50 times more likely to die from oral cancer, because your mouth is the first target of whatever you take, whether you're taking smoking cigarette, bidi, or taking gutka, or even betel nut, which is also injurious to your oral tissues. So first target is your mouth, and through which you will say that it can spread anywhere in the body. Now when you consume these things, initially you will see that there is something called as precancerous lesion in the mouth. Now this comes in it appears in the form of white patch. It might be on the lip mucosa, it might be on the cheek mucosa, on the tongue, under the tongue. So those are the white patches, and these are called as precancerous lesions. Now nothing happens to you when this condition appears, because they are painless. So patients are not worried about it. But if you do not stop these habits, they may increase, these lesions may increase and may turn into cancer, that is oral cancer. So we have to see to it that we go for a proper examination. Those who have already indulged into these habits, you can go for oral screening so that it should be prevented at an early age before it goes into oral cancer. Yeah, all of you are aware about this warning which is given on the cigarette packets. Next slide. Which says that it causes throat, lung and mouth cancer. Definitely when you are smoking, after targeting the oral cavity or after targeting the mouth, it goes into the throat and ultimately it goes into the lungs. Okay. Next slide. Next slide. So there will be, suppose if the precancerous had turned into cancer, that is oral cancer, so oral cancer spread anywhere in the body. So initially you will see these glands which are present in the neck, the cervical glands are affected, and through that it can damage the other parts of the body by something called as metastasis. So from the oral cavity, it may go elsewhere in the other parts of the body. Now, so the patient will suffer. Whenever there is a pain, oral cancer, patient will definitely suffer with pain. That is the main symptoms. So there will be excruciating pain. Patient will lose the weight and there will be no hunger and many other symptoms. So patient has to go for the treatment, right? So once they go for the treatment, you will see that treatment of the oral cancer also will have side effects. So person has already suffered with cancer, the different signs and symptoms of cancer, and when they are taking the treatment, so again patient will suffer with the side effects of surgery, radiation or chemotherapy, which is the main modality for the treatment. So suppose if there is a cancer in the oral cavity and some teeth have been affected, so you have to sacrifice these teeth, right? Sometimes you may have to remove the jawbone also. You must have seen many people with lot of disfigurement, facial disfigurement. That happens after the surgery. Radiation, you have seen people losing their hair, skin damage, pigmentation. Even after chemotherapy, so many people have seen the damaging effects. Next slide. So now considering the number of cases of oral cancer, you will see which ultimately may lead to different types of cancer, and that is a major concern for the society. My dear student, believe me, this is the major concern in today's world, and that is a challenge to the medical fraternity to cope up with such a large number of cancer patients. You can see the OPD outside Tata Memorial Hospital. Their OPD is 70,000 per year. Can you believe this is the number which can come there, but you may not be knowing the people who are already suffering in some rural areas. Okay? So such a large devastating picture you always can see here. Result of tobacco smoking. Tobacco in any form, whether smoking or gutka chewing, pan parag and all that. Next slide. Now the person who's smoking is already suffering, you have seen, but the people who are present in the family also get affected because of the smoke, right? Because the smoke, so that is called as second hand smoking. In that case, family people like the children get affected, and you will see that 1.5 million people suffer with secondary type of smoking, and more than 25,000 children, more than 25,000 children die every year because of second smoking. So it's a lesson for the parents to stop smoking and stop the damage which they may cause to the children. Next slide. Yeah, so here you will see the child will suffer. Patient may have sudden infant death syndrome. The second-hand smoking people may suffer with bronchiolitis, bronchitis, asthma, and different allergic reactions. Okay, I hope everybody is following. It's not very difficult to understand. Next slide. So how do we treat them? the main thing is we have to stop the habit. Main thing is stop the habit. And secondly, cessation by different methods, like using the medicine, the different gums and patches and chewable tablets are available. So that is a secondary thing, but main aim is to motivate the patient to stop the habit. Next slide. So these are the different chewable tablets which are available, but ultimately they also contain nicotine. When they stop, next slide, when they stop, then they get withdrawal syndrome. So in withdrawal syndrome, they become very irritable. They complain of lot of craving. They get a lot of craving to smoke. They are trying to stop, to stop and prevent from smoking. But they complain of sleepless nights, headaches, irritability. They even complain of constipation. But believe me, these are temporary. In some time, you will come over it. Those who are indulging into these habits, they will definitely come over it soon. So do not worry. But my next slide. But my next aim is that it should be stopped. So you will see in summary that tobacco consumption leads to not only the personal damage, physically and financially, but at the same time your family also goes through a lot of stress when they are taking care of you during the treatment or even after the treatment. Next slide. This is a very good example of motivation. This was one ration shop owner which was next to my clinic, and see the condition on your left side: badly carious teeth, badly stained, bad oral hygiene, and you can see the white patches which has appear on the lip mucosa, lip surface, you can see. So these are the precancerous lesion. Initially it appears patient has absolutely no problem. He came for the dental pain, but subsequently I saw that this is the main concern. Dental pain was taken care of, but here you can see the damage which has occurred to the lip mucosa. Now this is precancer. If the patient continues, then in that case it will definitely lead to cancer, right? There are many dangerous faces which I don't want to show you and scare you, but if you see this and see on the right hand side the result of stoppage, motivation. My Kakasha was very instrumental for this patient to stop the tobacco, and you can see the result that it is become absolutely normal. Imagine if he had not stopped by now, after I think 10 years, it would have definitely gone into oral cancer, and from there it would have definitely, don't know any part of the body. Next slide. So we have to take a social approach. That is why we want to involve the students so that they should help us. So here, based on the fact that fundamentally it is important to realize that the oral health, your mouth health, oral health is inseparable from your general health. I hope everybody agrees that your oral health is inseparable from the general health of an individual. So our aim is to highlight the health risks which are associated with tobacco consumption, and secondly, to advocate the needs for the effective measure for tobacco cessation. So I want each individual, all of you are educated, all of you must help us in this aim. Next slide. So what we do is we carry out awareness in the public, and 31st May is the main day where World No Tobacco Day is observed. So we go to different schools, different colleges, and we bring about this awareness on 31st May. But mere man ki baat, that every day should be a World No Tobacco Day, so that people stop. And in fact, I want to make this entire area tobacco free zone. Thank you. Next slide. So we go to different institutes. Next slide. motivate the teachers so that teachers will pass the knowledge to the students, and students will definitely go and impart the knowledge to their families, their relatives, their neighbors, their servants, their watchmen and all. The next thing, so we take different oath at different places at different occasion, so that this becomes an instrumental. Next slide. So that this is an instrument. Here we involve the 5 class 4 workers because they are more into these habits. Of course, I see students also, but these are the class 4 students. So in your complex also you will see that you have to involve them and stop the habits. Next. Yeah, so So what we do is we carry out different rallies, We do street plays. Our college, this Terna college is very important, instrumental. They carry out different street plays, so as to bring about the awareness. Next. And this social media plus your All India radios could be very good in imparting the knowledge. Next. What I want is tobacco-free India. And in this mission, all of you must help us in getting tobacco-free India and cancer-free India. Next slide. This is my survivor, a very good survivor, very cooperative. And I must tell you in conclusion to all the students that some investment never generate profit, but they make us rich. Yes, so we can utilize our knowledge, our expertise at the social level to bring about a noble cause. Thank you very much. I would like all of you to stand and take a pledge with me. Yeah, everybody is ready? Hello, everybody. Yeah, we are taking a pledge. On this day, at Rizvi College, we take the oath that we will help the society to make it tobacco-free India. Jai Hind, Jai Maharashtra. My sincere thanks to the management and Alkama sir to provide me this opportunity. Thank you very much.
Thank you, Dr. Afshan Lehji. Dear students, I'll take only 1 minute of yours. See, as Madam has mentioned, that 31st May, there is one important day that generally they visit the schools and colleges. That reminds me about one of the important message which has come from our director, Madam Advocate Mrs. Rubina Akhtar Hassan Rizvi. In a communication with doctors, she was discussing and she was telling that nowadays we keep on telling the college students and we stop them from smoking and we tell them don't chew the tobacco. But actually this initiative we should have right from the beginning, that is school life. So now, under the Help Yourself Foundation, inshallah, along with the Students' Council of Rizvi College of Arts, Science and Commerce, we will find out some good speakers, we will approach different schools, and under the able guidance of the founders of Help Yourself Foundation, Dr. Akhtar Hassan Rizvi and Advocate Mrs. Rubina Akhtar Hassan Rizvi, we will be visiting different schools and we will be making awareness against the cancer, and we will tell students of school that why it is so very harmful. Inshallah, I am very sure that will definitely help in making the prevention against this cancer and all ailments. Now I request Sabha ma'am to propose the official vote of thanks.
Thank you, sir. It's really my proud to give a official vote of thanks for today's session. I am very much thankful to Help Yourself Foundation for conducting such good programs, and I am really very thankful to our respected President Sir Dr. Akhtar Hassan Rizvi and Advocate Mrs. Rubina Akhtar Hassan Rizvi ma'am for thinking so much and caring so much about the society and giving us opportunity to be part of such event. Really, I am very much thankful to Dr. Afshal Aheji for sensitizing our students on such a sensitive topic. Ma'am, you didn't show the slide, but I really wish that the students should be sensitized by seeing what can be happen in the future if such they will be consuming tobacco. While starting up such habits, they really don't think that how they will be end up with what will be the results of such thing. They really don't care that what can happen to them. So I am very much thankful on behalf of Help Yourself Foundation, Rizvi Education Society. Thank you very much, and I am really very thankful for the audience to being so patient listener. Thank you so much. All the students will proceed for the lecture, no changes into the further schedule. So please go to your classes, and SYBSC, I am coming for the lecture.
Hello, 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 mic check. Hello, hello.
you.